Welcome to everybody to our first Discovering Debut webinar of 2024. On behalf of all of my colleagues at Acadia, it's my pleasure to welcome you to today's discussion and caregiver panel, which is one of the first ones that we've done in a couple of months now. I'm Parag Meswani, and I have the privilege of leading the debut team here at Acadia. And I'm joined here by a number of our colleagues who are going to be speaking throughout today's presentation. First up is Dr. Carrie Buchanan. Carrie is a developmental and behavioral pediatrician, and she's based out of the Center of Excellence at Greenwood Genetic Center in Greenwood, South Carolina. I'm joined by my colleague from Acadia, Sean Silva, who's a senior family access manager, and he works in our patient support services team and works directly with Rett families to support therapy initiation and provide support and education every step of the way. But the stars of our show today are Heidi, Allison, and Amy. And you're going to hear a lot more from Heidi, Allison, and Amy and about their daughters a little bit later in today's discussion. But what I'd like to do is maybe just a brief introduction before we kick off our presentation and allow each of them to briefly introduce themselves and their daughters. And why don't we start first with Heidi?
Hi, everybody. I'm Heidi, and I live in Colorado with my husband, Rob, and my 9-year-old son, Reese, and 15-year-old daughter, Ellie, who has Rett. I think we're your typical family. The only difference is, we're managing Rett like everybody else. Ellie is she's very energetic, and she likes to stay very active. So as a family, we like to try to do that as much as possible. My husband runs ultramarathons, Reese is in all the sports. I do what I can to keep up. We like to go skiing. Ellie does adaptive ski and loves that. And, she's your typical 15-year-old and is moody, is happy, is everything you can imagine a teen would be. She loves boy bands. She loves One Direction and Bruno Mars. She loves to hang out at home and watch TV. And then, like I said, she also likes to just be out and about and go on adventures, go traveling. And, we're just your typical family living here in Colorado and managing life with Rett.
Fantastic. Thanks, Heidi. I like Bruno Mars too, by the way. I think he.
Yeah. Who doesn't, right?
Allison, over to you.
Hi, I'm Allison, and I live in New Jersey with my husband, Brendan, and our 2 daughters, Anya, who is 9, and Claire, who's 7 and has Rett syndrome. Claire was diagnosed when she was 4 years old, right in the thick of COVID, May 2020, and it has definitely been a ride getting to this point. But it's going really well, and kind of to echo Heidi, we're just a typical Jersey family. We love our beach and our shore. We love being outside and walking around. I'm a marine biologist and a professor at a local college. My husband works in construction. The girls go to school every day. Claire is hysterical. She is super sassy and has such a personality on her. We used to say Claire don't care. Since she was little, she does what she wants to do when she wants to do it, no matter what anyone else says. She loves watching TV. She loves music. She scrolls YouTube. She's super into Mickey Mouse and Elsa and Moana and Olaf and all that. She is very active and mobile, and she's always running around the house or jumping on her trampoline. She loves going to the pool, the beach, and runs out to the bus every day. Just a typical, really fun little girl that we love watching to grow up.
Great. Thank you so much, Allison. And last, but certainly not least, Amy, over to you.
Hi, I'm Amy. I live in Colorado with my husband, Matt, and our 3 awesome kids. I'm a registered nurse by profession, and my husband, Matt, is retired Air Force, and now he's in the commercial airline industry. And now on to the best part, our kids. Maddie is living with Rett syndrome, and she's 20. I'll talk about her in just a minute, but let me talk about her siblings. She has Anna, her sister, who is a senior in high school, doing outstanding and just received her acceptance to her #1 college out of state. So I'm preparing my mom heart for that transition. She has a brother, Luke. He's our caboose. He's 10 years old, 5th grader. Maddie adores him. He's everything to her. We all get eye rolls. He gets love. It's pretty fun to watch them. Our family, we're pretty typical too. We like to spend time together. We watch movies, we go on walks. Maddie loves exploring in the mountains, so we load her up in the Jeep and she rides shotgun, and she very much enjoys that. She loves the Wiggles, and she's Harry Potter fan. She is part of the Gryffindor house, but she has a little Slytherin in her. She loves football and basketball and baseball, you name it on sports, she loves it. She's a huge fan of New Orleans Saints, Denver Broncos, and the Nuggets. And so that's been a lot of fun for her to watch some NBA games. The last 2 years, Maddie was pretty honored to be an ambassador at Children's Hospital Colorado. And she's the first young lady with Rett syndrome to be a patient ambassador for them. So we were pretty proud of her doing that. I guess the most important thing to realize is Maddie is nonverbal, and so she did advocate and was a great ambassador with just using her communication device, and so that was pretty extraordinary. She went to Washington, D.C. last summer, and she spoke to all of the Colorado delegates on the importance of rare disease, clinical drug trials, and pediatric mental health, and the importance of it. And she did all that by using her Tobii communication device and was just spot on. And I think she made a lot of change. During the week, she has graduated high school, so she attends an adult day program twice a week with her home health nurse, Jenna, who's like her best friend. She tells jokes. She hangs out with teenager friends. She likes to shop and go out to eat. And I guess just a little bit about Maddie with her Rett syndrome. She was diagnosed at 2.5. She's nonverbal, non-ambulatory. She does have seizures and apnea, cortical visual impairment, a G and a J tube, and a colostomy. So she's got a lot of little needs happening, but no more than what the rest of you guys are facing too. So she's 100% dependent on us. And so, yeah, like that's our story.
That's great. Thank you, Amy. Let me just thank Heidi, Allison, and Amy just once again for joining us, for taking the time to share your personal experiences as moms and as caregivers, and I think for the group that's joined us this evening, for giving us a little bit more of a window into the lives of Ellie and Claire and Maddie. The goal here is to really provide a real life perspective on living with Rett and now life with DAYBUE as well. So I want to thank you in advance, and very much looking forward to learning more about your stories and asking you some questions a little bit later in the discussion. So thanks so much again. So let's jump into the agenda for today. So there's 3 primary topics that we will be covering for today. The first is we want to talk about DAYBUE. DAYBUE was approved in March of last year, and we've invited Dr. Buchanan, who has a lot of experience treating Rett and also with DAYBUE, to walk us through some background on this treatment. What is DAYBUE? How was it studied in clinical trials? And what were the results of the phase 3 lavender clinical trial that led to the approval of DAYBUE last year? And what do we know about side effects? We've learned a lot about DAYBUE since it was approved last year, and we want to take the opportunity to go through what have we learned about the efficacy or the impact of this treatment on the core symptoms of Rett, and how do we understand and manage some of the side effects that come with any new treatment, including DAYBUE. Second, we want to go through Acadia Connect, and my colleague Sean Silva, who you met earlier in the presentation, will walk you through Acadia Connect and some of the key components of this patient support program, the team that's involved, and really the comprehensive support that we aim to provide each and every single family who decides that DAYBUE is right for them, and the comprehensive set of support that we will provide through our family access manager team and through our pharmacy partners to support you every step of the way. And then for the remainder of our discussion, we're just going to pause. We're going to have a caregiver panel discussion to hear from Amy and Allison and Heidi and about their children. And we have a series of questions to walk through the diagnosis, the treatment journey, and many other questions that I know some of you may have on your minds as well. So with that, if we go to the next slide, what I would love to do is invite Dr. Buchanan up to the stage here to start our discussion around DAYBUE and kick us off. Dr. B, over to you.
Great. Thank you so much, Parag. I just want to echo what you said. I could listen to Heidi and Amy and Allison speak about their girls forever. It's just a true reminder of, why we do what we do. So thank you for being here tonight. Also, thank you for having me here tonight. I'm really excited, or I should say maybe this afternoon for some, but this evening for me. I'm really excited to be here to discuss DAYBUE, which of course is the first and only FDA-approved treatment for the signs and symptoms of Rett syndrome. So what is DAYBUE? Well, as I just mentioned, it's the first and only FDA-approved treatment for Rett. It is available for adults and for children 2 years of age and older. It is an oral medication that's given twice a day. It's a liquid medication that is dosed based on your child's weight. So your doctor will recommend the right dose for your child. It is given orally, or it can be given through a G-tube. So an important question to ask is, how was DAYBUE studied? How do we know that DAYBUE works in Rett syndrome? So the effectiveness and safety of DAYBUE were both evaluated in a large phase 3 trial. This clinical trial was called the Lavender trial. It was a 12-week trial that enrolled 187 female patients. 93 were given DAYBUE, and their results were compared to 94 patients who were given placebo, which was an identical treatment without an active medication. Following this 12-week Lavender trial, the families were given the option to roll over into what's called an open label trial, where all participants received DAYBUE. And 154 patients actually were enrolled into LILAC. They were given the medication for up to 40 weeks, meaning some of these girls and young women were on this treatment for a full year, for 52 weeks, but all of them had the opportunity to receive it for up to 40 weeks. Next slide, thank you. So what was assessed specifically? So as I said, half of the group was given the active medication, DAYBUE, and half was given placebo. Over a 12-week period, their results were compared. And so both caregivers and physicians assessed efficacy and safety. And so both the effectiveness of DAYBUE and the safety was evaluated by caregivers and physicians. So the caregivers completed something called the Rett Syndrome Behavior Questionnaire, or the RSBQ, and physicians completed the Clinical Global Impression Improvement, or CGI-I scale, to evaluate if their patient improved over the 12 weeks. Again, caregivers completed the RSBQ. So this is a questionnaire that assesses a range of symptoms of Rett syndrome. There are 45 items that really represents specific symptoms of Rett syndrome. The RSBQ is a scale that's really only used in studies of Rett syndrome. But if your children, your daughters have been involved in the natural history studies, you're probably familiar with it because it is used in the natural history study. But it specifically assesses symptoms of Rett syndrome. Again, there are 45 items, and it's completed by the caregiver. It assesses many different symptoms that we're all very familiar with. So it looks at mood, changes in mood, breathing abnormalities, eye gaze, nighttime behaviors, the Rett parties we're familiar with, facial expressions, hand stereotypies, hand movements, vocalizations, and then other repetitive behaviors like body rocking and teeth grinding, things like that. Next slide. So as I said before, researchers compared the results after 12 weeks of those that were given DAYBUE and those that were given placebo. And so the average change in the total RSBQ score was compared to those given DAYBUE versus those that were given placebo. And you can see here at 12 weeks, the girls that were receiving DAYBUE improved almost 5 points on the RSBQ, whereas those that were just given the placebo only improved by 1.7 points. And so I didn't really go over this previously, but I'll just say the RSBQ, it's a 3-point scale. So 0, no change, 0, not a problem at all, 1, sometimes a problem, and 2, very, a pretty significant problem or occurs frequently, like hand stereotypies, for example. So an improvement in 5 points is really quite a significant improvement on the RSBQ. And you can see that there was almost a 3 times greater improvement, or a decrease, because a higher score is a higher severity, almost a 3 times greater improvement in the girls that received DAYBUE than those that were given the placebo. Again, the identical medication that does not have the active drug. Similarly, at 12 weeks, doctors observed improvement in the signs and symptoms of Rett syndrome, specifically in the girls receiving DAYBUE compared to those receiving placebo. So the CGI-I looks really at improvement overall. It is we use Rett syndrome specific anchors. So we really look at specifics, again, symptoms of Rett, but we give an overall change. And so a 4 would be no change at the end of 12 weeks. And then 1, 2, and 3 would be varying levels of improvement. And then if a patient was given a 5, 6, or 7, that means that they showed signs of worsening. You can see here that 4 out of 10 patients, almost 40% of those on DAYBUE, had some level of improvement at 12 weeks, either much or minimally improved, versus those who were on placebo, only about 15% demonstrated any improvement. And you can see, too, much higher, much improved than there was, and minimally improved in the girls receiving DAYBUE versus those on placebo. Next slide. So there are possible side effects of DAYBUE, the most common being diarrhea, which if you're here tonight, you've probably heard of. This can sometimes be severe, so it's very important to monitor for dehydration, and being in contact with your physician to really discuss potential side effects. Another possible side effect that was observed is weight loss. And so, if you feel like your child is losing weight, that's definitely something to discuss with your healthcare provider. So during the 12-week lavender trial, other side effects were observed. As you can see here, certainly diarrhea was the most common side effect seen in DAYBUE, with about 82% of girls receiving DAYBUE experiencing diarrhea. And then again, almost 30% that experienced vomiting. And you can see here, more so than that occurred in the girls and placebos. Other potential side effects, there was fever reported, seizures, anxiety, decreased appetite, tiredness, and then the common cold. Again, these are just some of the possible side effects. Of course, there could be others, and so we want you to be communicating with your healthcare provider. There are some helpful tips for managing diarrhea. And so before we start a patient on DAYBUE, and if this is something that you're considering, we would ask you to consider keeping a log to kind of to track your daughter or son's stool consistency and frequency. So basically like a stool log for about a week prior to starting treatment, just so you can kind of have an idea of what their baseline is. You're going to want to talk to your doctor, discuss any over-the-counter stool softeners or other medications, dietary supplements that your daughter might be on for constipation. And you're going to want to stop all of them and all prescribed laxatives as well. And then also talk with your doctor about any potential dietary changes that could potentially help minimize diarrhea. And then I recommend all my families go ahead and have Imodium and a fiber supplement on hand. Because if and when the diarrhea hits, sometimes it can be unexpected, it could be in the middle of the night, and it's kind of nice to have those medications on hand. But again, if any of these side effects do happen, we want you to let your primary care physician know, and really keep an eye out for signs of dehydration. Again, your doctor might suggest adding fiber, like we talked about, again, adding an antidiarrheal such as Imodium, but you can also reduce the dose or stop or discontinue the DAYBUE until the diarrhea improves. I think an important thing that if I haven't already said enough, communicate with your healthcare provider. So there are certain things that your healthcare provider needs to know before they prescribe DAYBUE. They need to know all the medications your child is on, let them know about any over-the-counter medicines, vitamins, herbal supplements, all stool softeners and laxatives. And also it's important to let them know if your daughter or son have kidney problems, because that may potentially be a contraindication to DAYBUE. So just a quick note on dosing in DAYBUE. So again, it is an oral medication that's given twice a day, morning and evening. It is a liquid. It's a strawberry flavored liquid. And as I mentioned before, it is given orally, but it can also be given through the G-tube or a G-port of a GJ if that's what your daughter has. It is weight-based. So depending on your child's weight, your doctor will instruct you on the proper dose. It can be given with or without food. We do recommend that if your child vomits, to not try to give them vomits after taking the dose. Don't try to give that dose again. Just wait until their next prescribed dose later in the day. Or if they miss a dose, don't try to catch up. You can just skip that dose and give the next dose as scheduled. Next slide. Okay, so that's really it for me. So now I want to introduce Sean Silva. I know Parag already kind of introduced Sean. He's a Senior Family Access Manager at Acadia, and he is going to discuss Acadia Connect.
Thanks so much, Dr. B. Hello, everyone. Good evening, good afternoon, depending on where you are. I'm Sean Silva. I'm the Senior Family Access Manager at Acadia, as Parag had shared earlier. And I have the privilege of working closely with local patients and families in my area, providing them support throughout their treatment journey with DAYBUE. And as a family access manager, I am a part of a larger patient support program known as Acadia Connect. So I'd love an opportunity to provide some information and education about what type of support services Acadia Connect can offer should you and your healthcare provider decide that DAYBUE is right for your loved one. So Acadia Connect is a patient and family support program that connects your family with educational support and resources throughout your treatment journey with DAYBUE. Now, who makes up this team at Acadia Connect? Those are the dedicated and experienced support team members that include a family access manager, so that would be someone like myself, as well as a nurse care coordinator. And we work really closely together as a team to ensure that you as a family have the support and information about DAYBUE as you begin this treatment journey for your loved one. Now, support for Acadia Connect, there's really three kind of pillars, if you will. And the first being cost and insurance. This is often one of the very first questions that caregivers have. So Acadia Connect will verify insurance coverage and benefits for DAYBUE with you, as well as provide education and help physicians understand the process relating to prior authorization or appeals processes, if that's what's required by your insurance plan. In addition, Acadia Connect will connect families with financial assistance options. In addition, Acadia Connect assists with coordinating prescription details between a family and the specialty pharmacy that will fill the DAYBUE, and that is Anovo RX Specialty Pharmacy. So briefly, a bit of information about Anovo RX. They are the exclusive specialty pharmacy partner that Acadia Connect works with. So they, as a specialty pharmacy, they are experienced in working with rare disease communities, and they have experience working with medications that have special handling, storage, and delivery requirements like DAYBUE. So Anovo Specialty Pharmacy is who processes and fills prescriptions for DAYBUE and is able to ship those directly to families' homes or a location of their choosing. And lastly, Anovo RX Specialty Pharmacy has a team of clinical pharmacists that are available 24/7, and they're available to answer questions about DAYBUE, questions about side effects, as well as offer clinical recommendations whenever appropriate. So one of the last, just back one slide, just for a second there. One of the last pillars of the Acadia Connect support program is, of course, ongoing support and education, not just as your loved one initiates treatment, but throughout the treatment journey as your loved one progresses through treatment. Next slide. So as I discussed earlier, so the family access manager and the nurse care coordinator at Acadia Connect, we work together with a goal to provide support and information to your family every step along the way. So the nurse care coordinator is likely the first person that a family would speak with upon enrolling at Acadia Connect. And the nurse care coordinator would provide you with an overview of the services and support that we would then offer you. In addition to that, as I had mentioned earlier, the nurse care coordinator will help you with financial assistance options if necessary. In addition to the nurse care coordinator, someone like myself as the family access manager, we are going to provide you with the personalized local support that you need as you begin this treatment journey. We work very closely with physicians and their staff, especially as your loved one starts treatment, to ensure that they have the support that they need in terms of provider education as it relates to prior authorization and appeals if necessary. The support that someone like myself as a family access manager provides is not just as you initiate treatment, but throughout your treatment journey. We're always going to be available to you to discuss any questions that you have throughout the way. And we'll see what that ongoing support looks like in the next slide. So here we have one of our family access manager team members, John. So again, our goal is to make sure that you as a family have the support that you need for your loved one as they begin treatment and stay on treatment with DAYBUE. And how we offer that support, we're able to meet with you wherever is most convenient for you. So whether you prefer to meet in person at your home, we're happy to meet you there, as well as through virtual platforms to help you understand and provide education about DAYBUE, information that's important, such as potential side effects, as well as discuss and share some tips, tools, and resources as it relates to those side effects. Our goal is to make sure that you have the information that you need so you feel confident as you begin this treatment journey. Now, as it relates to sharing tips and resources to making sure your loved one is set up for success when starting treatment, although family access managers, we cannot provide clinical direction. We will always direct you back to your physician, but we can certainly help you develop questions to ask, as well as share best practices with you on what has worked and what we've seen as a community. So again, our goal is to make sure that you are not alone in this process and that you always have someone that's available to you to discuss any questions or concerns that you may have. Now, how to enroll in the support. So once you and your physician decide that DAYBUE is right for your loved one and a prescription is submitted, you can enroll in Acadia Connect support services in one of three ways. One of which is by signing the patient caregiver consent form that is attached to the prescription while you're in the doctor's office. However, if you're not in the doctor's office when this form is submitted, you're also able to sign and complete the HIPAA authorization, allowing our services on the Acadia Connect website. Lastly, you're also able to reach out directly to Acadia Connect and speak with a nurse care coordinator who can assist you with formally enrolling in Acadia Connect. Next slide. And again, can't reiterate enough, but our goal as an Acadia Connect patient support program is to ensure that you have all of the support that you need. There is a website where a lot of resources are available. Should you be interested, it's acadiaconnect.com, and 1-844-737-2223 is the phone number for Acadia Connect, where we're available Monday through Friday from 8 a.m. to 8 p.m. So with that, I will get back to Parag, who will get us started with our wonderful caregiver roundtable discussion.
Fantastic. Thanks so much, Sean, for walking us through Acadia Connect. And Dr. B, as always, thank you for walking us through some of the background data on DAYBUE from an efficacy and safety perspective. So we're going to transition over and get into the caregiver roundtable. Now, let me just make a couple of comments to frame a little bit of background before we dive in. So we had a chance to have a little bit of a background from our three caregivers. And so for today, we're going to learn about Maddie's experience. Maddie is now 20, and we'll dig into what her experiences look like on DAYBUE. We're going to learn more about Claire, who is on the younger end, around 8 years of age. And then Ellie, who is kind of in between, around 15 years of age as well. So, one thing to note is Ellie, Claire, and Maddie, they were all in the DAYBUE clinical trials. And that means that they've been on therapy now for over 2 years, likely a lot more than 2 years as well. So they're coming from the perspective of some time on therapy, and we want to unpack and discuss a little bit about their decision to go into the clinical trial, their decision to try DAYBUE, and more importantly, what's their experience been early on, and what has their experience been in the months and now years leading us to where we are today. As all of you may know, Rett's very different, right? Each child, each daughter, each person, male or female, presents differently with this disease. And it's the same thing with treatment outcomes as well. And so what Maddie's experience has been may look different than what Claire's experience has been, and same for Ellie. And I think that's a point we want all of you to take away is each individual experience is different. And because each individual with Rett is unique, with a unique set of symptoms, the response and the experience they have with DAYBUE is also going to be unique. And it may be different for different people. So you're going to hear from 3 different experiences, 3 different age ranges, starting at different time points to learn about their individual experience. But at the end of the day, we are just providing this as background. We want you to take that information, understand what it means for you and for your child, and speak to your doctor about what's the right next step for you as well. So with that, I'm going to invite all of our caregivers back up to the stage here. And we've heard a little bit from Amy, Allison, and Heidi already about their children and about their backgrounds. What I'd like to do to maybe kick us off is dig in a little bit into the decision to start treatment for Rett syndrome. And so, we've heard a bit from each of the different caregivers, and what I want to hear specifically, starting maybe first with Allison. Actually, if we can go to Allison's slide, I want to hear about, Allison, your decision to start DAYBUE. What were you thinking about for yourself and for your family, and for your daughter as well? We'll start with you, and then we'll.
Yeah. So, like I said, Claire was diagnosed in May 2020. It was the height of COVID. We were home alone, and we got the call from the geneticist that she had this Rett syndrome that we had never heard of. We didn't know anything about it. And I'm a I need to know everything person. So like immediately went online and found where to go. And we came across IRSF, and we came across the Rett Centers of Excellence. And here in New Jersey, we're very fortunate. We're smack dab in the middle of 2 Rett Centers of Excellence at Children's Hospital of Philadelphia and at Montefiore. We chose to go to CHOP with Dr. Marsh, and it was a great decision. Him and his team are wonderful. They've worked with us every step of the way. And as soon as they met Claire, they're like, we have this drug trial. She was not quite old enough then. They were looking for 5-year-olds. And so we met with him once or twice, and he, went through the criteria, and he's like, she's a perfect fit for the trial. We were all in and decided to see where this would take us. She turned 5 in March of 2021, and in June she started the trial. And in September we started the open label part of the trial. So we've definitely been on the medication since September of 2021. And we talked with Dr. Marsh about possible side effects, about changes that Claire would see, changes our family would see, and just felt really comfortable with what might happen.
Perfect. Maybe Heidi, what about you? What were some of the considerations that you were thinking about?
Well, we had known about the first Trofinetide trial, the one in 2016, I think it was. And so I was extremely excited when I heard it was, there was another one, and we wanted on it. And I kept, we see Dr. Benke in Colorado, and I kept bugging him about getting Ellie in this trial. And then when it finally came to, and we got to start, I was so excited. And I think, it very similar to Allison. It's like, you just want to do anything you can to help. And I was just so excited to see what this could do. And I think because, also it was the beginning of the trial. I believe we were the first participant in Colorado. So we kind of just went in, not really, we knew there could be diarrhea. We knew there was side effects. Dr. Benke was very good at, we were very educated on what we could expect, what we needed in our toolbox in case it happened. But I think more than anything, we were just so excited to be part of it and felt very lucky to be part of it. And, we wanted to really have it be successful so everybody else, could have access to it like they do now. So it was more just excitement. I just think we were just happy to be able to be part of this group that got to be in both trials.
And remind me, Heidi, again, how long have you been on Trofinetide?
Yeah, December 20th, it was 3 years.
3 years. Okay.
So we've been on it a long time. Yeah. We did have a little break, a little COVID break. But we'd finished Lavender right at the cutoff when the hospitals closed down. And so we had to wait a few months before we could start Lilac. And then once we did start Lilac, now it's been 3 years. So yeah.
That's great. Well, we're going to get into what the most recent experience is and how that's progressed over time since you initially started a little bit later. But Amy, let me invite you to the conversation. Talk to us a little bit about your experiences with Maddie and considerations to start a treatment for Rett like DAYBUE.
Yeah, so Maddie was in the initial Trofinetide trial, 2016. So when we joined, we did have a lot of unknowns. We really didn't know what the side effects were going to be. And so we went in, asked a lot of questions. Dr. Binky, we also see Dr. Binky at Children's Hospital, Colorado. We were a little more nervous because we didn't know what to expect since we were in that first initial phase. We were really excited and we were really hopeful. Our hope going in was that Maddie would have some relief of symptoms. And even if we had one improvement, we were going to call it a win. And back then, in that phase of the trial, it was a lot of placebo. So we also knew there was a really good chance we would get a placebo, but we were so willing to do it. Maddie at that point was 13 years old. And so we talked with her. She was completely on board with going for it. We had a really big family discussion. We met with Dr. Binky a few times. We felt very informed, as formed as you can be in an initial clinical phase. And then I actually was going through photographs today and I found the picture of Maddie from Children's Hospital. And we had our big, huge insulated bag of 2 bottles of the medication. And I just remember I sent my dad a text that day and said, we have hope in a bottle. And that's kind of where we were even from the beginning. Just we wanted some hope, and Maddie wanted hope, and we followed her lead and we went for it.
Well, thank you for having that hope, and I think that hope is what has gotten us to the approval of DAYBUE. So thank you for that. I want to stick with you for a second, Amy, just because we've gotten some questions, even in today's webinar and over the past few months as well, about considerations for starting DAYBUE when you have an older child, somebody that may be a teenager, somebody that may be over 20. And as Dr. Buchanan mentioned, our phase 3 clinical trial tested trofinetide in girls who are between the ages of 5 to 20. But it's approved for anybody with a diagnosis of Rett syndrome, male or female, if you're 2 and older. So I'd love to maybe just hear a little bit more from you on, what are some of the questions you thought about with an older child? Maddie, I think you said started as a teenager. What was your perspective? What were the questions going through your minds at that time?
Well, we're very excited for the younger Rett community. I am so hopeful for them, and it's so exciting to have a treatment. But I do want the older, the caregivers of the girls that are a little older to consider this, because Maddie has had great improvements in so many areas: mood, eye gaze, breathing. She just feels good. She tells us all the time she feels good. And so as far as her age, she's just on a lot more medications than maybe some of the younger girls. So, of course, we went over that with our physicians, and we made sure that everything was okay, and Maddie qualified for all the trials. And so we just went for it. But I do want to just probably just let parents and caregivers know that if your girl is 20 and 30 and above, and if you're comfortable and if you have talked with your providers and you feel like it's a good plan, it's worth a shot, because it gave us a lot of hope, and Maddie has seen definite improvements.
That's great. And we're going to get into some of the specific improvements that we've seen across all 3 of your experiences. One point I'll add is, since DAYBUE was approved, and I would say as of the end of September, we have over 800 Rett patients that are now on DAYBUE. That number has grown. So obviously that number is a lot bigger at this stage in January than it was at the end of September. But the reason I mentioned that is about 25% of the patients that are on DAYBUE are actually over 20. So there are quite a few families that have decided that even at an older age, DAYBUE is something that is worth trying. So I offer that just as a fact, because we obviously tested DAYBUE in the phase 2 trial in girls that were up to 20, and your daughter being one of them, maybe. But we're seeing a lot more utilization in the post-approval world for girls that are younger. If you're 2 to 4, 5 to 10, and now 20 and older as well, we're seeing a really broad utilization of DAYBUE, both for physicians that are prescribing and families that are deciding that this is a treatment that they want to give a try, like you decided to do, Amy, as well with Maddie. So thank you for that. So I want to get into the next set of questions and bring our other caregivers into the conversation. And this is around responses that you saw that were observed with DAYBUE. And one of the most common questions that we get asked, that caregivers ask us, maybe other caregivers, other families ask you as well, is what are some of the initial responses? What did you see in the beginning after you started DAYBUE? Can you comment to that? What were the types of improvements you saw? And when did you start to see them? And I'll stay with you again, Amy, and then we can transition over to Heidi and Allison.
Sure. So ours was, the initial response was back in 2016, and we've all lived through COVID since then. So I'm a little fuzzy on everything. But Maddie actually we started seeing improvements really quickly with Maddie. The things that stick out to me the most were her breathing. She had a lot of issues with breathing and breath holding episodes, and we saw improvements with that rapidly. And her eye gaze and alertness are some of the things that we initially saw quick responses with.
Perfect. What about you, Heidi? What's been your experience?
I think for us, the first thing we noticed was, I always like to say, it's like she couldn't see and she put glasses on and all of a sudden her world just opened up. It's like she just turned on. Not that she was off, it's just, it went to that next level where she was back almost. And she also, her emotions and her moods and everything, she just seemed to be happy, more connected to all of us, interested in things, and laughing at appropriate moments, like if she was watching a show, and just overall just more aware, I guess, was the biggest thing. And her, a little bit quickly on communication, her yes no turned on real quick. So she would always look at us for yes and look away for no, but it started to become like instantaneous. Like you'd ask her a question and she'd look directly at you for yes, look away for no. And I think that made it easier for us to communicate with her, at the beginning too. And then I don't know, she just turned on. She could just see her world around her better, navigate through it better, manage it, get excited about things. And that was really, really fun to see with her.
And Heidi, talk to us a little bit about just the time frame. When did you see that?
Yeah. And, I think this is also really important to know. And again, we've been on it 3 years. And, I saw that the awareness happened quick, but it's like some of the other stuff didn't happen for a while. And I would say it was about really 6 months before we started seeing, more physical improvements. Like she always could use her right hand. I mean, to hold it, she could hold a sippy cup, but it was a little wobbly. But she became much more, she had like strength and power holding it. And she started to use her left hand, like to hold things up. She, feeding herself became better. She would pick up food and we could lay, it used to be I'd lay a couple pieces out in front of her and she'd swipe things off the table. And I started laying a ton, like I could put like 8 pieces of booty in front of her and she'd just pick it up one by one and eat it. So just, things like that, like her fine motor skills got a little bit better and stuff, but it's all continuously happened over these 3 years. And it's like, when you look away, something seems to happen. When you stop watching for it, it happens. But yeah, it's been a continuous thing, and it has taken time. I just keep saying slow and steady, slow and steady. And the longer we stay on it, the more we see.
There's a patience aspect, I suppose, to that.
Yeah, it's just part of our life now. DAYBUE is part of our life, so it's you kind of don't think about it anymore. It's just there.
Allison, was your experience similar? Was it different in some ways?
For us, it took a little longer to see the results. Claire had one of the lesser known side effects that Dr. Buchanan was talking about, where within the first week or two that we were on the open label, she got very angry, like her behavior changed. She's a very happy, calm kid, and she was like and biting, her hand, and just, moms know, like she wasn't acting herself and she was anxious. She was up a lot more. I mean, she never sleeps, so she was really never sleeping. And we just knew it wasn't right. Like there was something that changed. And so we talked with her team, and she's supposed to take 30 milliliters for her size, and we backed her down to 15. So she's on like a half dose, and it went away like immediately. We really saw like she came back to herself, and then we tried to go up a little bit. It happened again. We tried to go down. And so after a few weeks, we just kind of settled at the half dose, and it took a couple of months, but we started slowly seeing changes. Very small changes at first, where like we who saw her every day didn't notice, but like my parents had gone to Florida for 4 months, and they came back and they're like, oh my God, like when did she learn how to do that? Her grasp with her pincher grip is much better. She can feed herself easier. She can hold things with her hands. Her attention, like everyone's been saying, she pays attention to you. She looks at you. I could say like, Claire, look at mommy, and she snaps her head to you. One of the things that we noticed very happily was for like 3 years, it was one single TV show. That was it. One show all the time. It was the only show we'd watch. She now watches like 10 different shows, and she'll pick which one she wants. So she kind of got out of that, like we only did the same thing. She only ate the same snacks. We eat more variety now. And that was a big game changer for us in terms of like her personality opening up and her options opening up.
That's great. That's great. I want to invite Dr. Buchanan up to the panel here for a second as well. You obviously had the experience of prescribing DAYBUE now as well. What are you seeing, and what's your initial guidance as well for those that are considering DAYBUE?
Absolutely, yeah. It's a big question. So one thing I've kind of heard and maybe want to reiterate is that every child is different, so the response that all of these girls and boys are going to see will be different. One thing though, it does seem pretty consistently, we do, if they're going to be side effects, we tend to see them maybe earlier on before we start seeing really the positive benefits. And so I think that's one thing to be prepared for, and to be aware that you might see some of these tolerability issues before you really start seeing the really big improvement. And so to kind of just work through them with your physician, and to be prepared for them, and it kind of makes that transition easier. Regarding how quickly it starts to work, every child is different. We have some patients who have seen responses really pretty quickly, within a few weeks or so, that increased alertness, more awake, more responsive, kind of faster, improved eye gaze. Though we have many that don't see that early on. I tell all my families we're going to give it at least 6 months, as long as they're tolerating it, before we really are, say, okay, this maybe isn't going to be the drug for your child. But I think it's important, and I think one of the moms mentioned that some of those more obvious improvement you start to see after they've been on it for a while. Another thing in the real world, the real world is really different than the trial. A lot of different protocols are kind of happening, and so some not official, but some physicians are maybe starting at a lower dose. Or one thing that is actually in the approval is, if you start having side effects, it's okay to decrease it. And so anytime you're adjusting the dose from maybe that goal main dose, it could potentially prolong, length of time before you're going to start seeing the positive benefit. And so that's something to remember as well. We don't really know, because we didn't study it in the trial, can we still get to that, real maximum benefit on a half dose? Obviously, we did see improvement in Claire when she was on the half dose, but that might not be the same for every child. And so I think being prepared for the side effects, but also knowing that the data is there, that it does work, but that giving it at least 6 months to see if you see the improvement in your child.
So you use it, being prepared for side effects obviously is important.
Mm-hmm.
Titrating up is something that, as you mentioned, a lot of clinicians are doing this. And if you have concerns about tolerability, this is something you should speak to your doctor about, right? These are all very individualized decisions, and you should do what's right for yourself and for your family, first and foremost, and give it a chance, right? And I think that's one of the themes I'm hearing across all 3 panels as well, is once you try, the experiences may be different. You got to wait different periods of time to see the benefit. And I think that, again, like with Rett, as we said at the beginning, the responses and the time to see benefit are going to vary. But I want to pull on the thread on side effects for a second, and management of side effects. Having a plan, being prepared to manage potential side effects is important in general, for any new therapy, for any treatment, including DAYBUE. And so what I want to do is I want to invite the panelists again to speak about what have you seen in your child from a side effects perspective? What plan did you have in place? What questions did you have to ask your physician when side effects occurred? And what strategies have you used and are you using to manage them? And let me first start with you, Heidi. Talk to us a little bit about your experience from a side effect perspective.
We had some issues, different types of bowel movements, and it seemed like her body was adjusting to it. But nothing, a couple times we had a little, but I don't know if it was, I think we started to manage that with diet and bananas and bagels and the whole thing. So we really still had constipation through it and had to manage that. The one thing she did get was gas. And it took us quite a while to figure that out. I don't think it really got bad until probably about maybe a year and a half in. And then we figured out, she'd burp and you'd smell it, or like a few hours later, you'd smell it. And I was like, something's wrong here. So then we worked with Dr. Benke again, and we started Gas-X, and that made a huge difference for her. And then towards the end of the trial, it was getting pretty bad. Like she'd get in the pool and she'd get upset, a few minutes after she'd been in the pool. And again, I couldn't figure out what it was. So then we kind of adjusted it again. We added some different kind of gas meds, and we did actually take her off for a little bit at the end of the trial, just to give her body a little break and see if we could get rid of some of that gas that kept building up. And then when we did restart, we did titrate up, just to, give her body a little chance to get back on it. I usually give her a Pepcid at night before bed. I'm very mindful of her diet. And, like if she has pizza, I make sure she has a Gas-X and a Pepcid before bed. That's like our thing. So I think that's helped for us to manage the side effects throughout, the last 3 years. But really for us, that was the gas. And, you can tell it was pretty painful, but it is definitely manageable.
You got through it. Yeah. What about you, Allison? You mentioned some side effects that you were going through in the clinical trial as well. What was your strategy to help navigate through that?
So when we first heard about the side effects and we were talking with Dr. Marsh, obviously diarrhea is the one that everybody hears about. And I was like, well, we have pretty bad luck. So I figured we were getting that. And we stayed home for like 4 days straight. We didn't leave the house. I said, if this is going to happen, it's going to happen here. And she actually never had it. Claire has really bad constipation and gas naturally. And we never got there was no change in it. We had taken her off of all of the constipation meds prior to that weekend, thinking she was going to get diarrhea. And it just got her really backed up, and we had to go kind of do a whole clean out. Like the one side effect that we've really seen is this behavioral changes, and the loss of sleep and the changes in her mood, her anxiety, her interactions with everyone. And it wasn't just at home, it was at school, and she wasn't herself. And so we kind of lowered the dose to manage that, and we've seen it. We are moving at a snail's pace. She goes up 1 milliliter at a time, like every 6 weeks. It is slow and steady. We're up to 19 milliliters now, from our 15, but I said slow is better than no. And we're still seeing improvements. So we haven't stopped or considered coming off of it, because even at this small dose, we're seeing small improvements, and small improvements add up to big improvements over time. And so we're really happy with that.
You're working your way up. What about you, Amy? What's been your approach? What have you observed, experienced with Maddie?
We were very fortunate with Maddie. Maddie has a lot of pre-existing GI conditions that we had before we entered the trials. Maddie did experience a little bit of vomiting and spitting up, but she was already diagnosed with GERD and on medication for that. And all those things were really manageable for us. And so all in all, we didn't really experience many side effects. And as far as the diarrhea, Maddie She has an ostomy bag, and so we did not have to experience that. And so I feel very fortunate that Maddie did not have the severe side effects. And Maddie has been on the 50 milliliter twice a day dose since the beginning. And that's what she maintains.
That's helpful. I want to put Dr. Buchanan on the spot for a second, because we've heard Amy's experience and Allison's experience, and I think one of the big questions that's out there is this diarrhea. Am I going to get it? How bad it's going to be? From the clinical trial, remind me if I'm off on this, but about 20%, so about 1 out of every 5 participants in the clinical trial didn't experience diarrhea. So I think it's worth just mentioning that, because I think that speaks to perhaps what Amy you saw and what Allison your experience as well. Not everybody's going to get it, but it's part of the drug's product profile, right? Would you agree with that, Dr. Buchanan?
Absolutely. You know, these 3 moms were fortunate, really, that their daughters didn't experience it, because to have three out of 3 here talking and none of them experiencing diarrhea is just really probably not accurate to real life. I would say the majority are experiencing diarrhea, not all, certainly. But really it is manageable, either with the, antidiarrheals, fiber to kind of like thicken the stools, playing with the dose. There are certainly ways to manage it. But the majority, though, are not experiencing extremely severe diarrhea. Most, and in the trial and in real life, seems to be mild to moderate. Understood.
Thanks for that context. Did you have anything else?
Well, I was going to say, I think this is just a perfect example again of how different everyone is, and we heard about, I'm glad we heard about the rare side effect of some worsening behavior, because we've seen that in our clinic as well. Again, but I also think it's important to know there are ways to mitigate that as well. And so, the side effects are very variable, just like the positive responses are.
Well, that's a good transition. Let me invite the caregivers, the panel again. What's your advice? You have somebody that's thinking about DAYBUE, and they're on social media and they're seeing some feedback on side effects, or they're reading about side effects, and they're thinking about, is this something we should do? Is this the right thing for our family, for our child? What's the advice, Amy, starting first with you, that you would offer to a caregiver that's on the fence, that wants to learn more, that wants to understand a bit more about the side effect profile?
I would be hesitant if I was reading all the things on Facebook about diarrhea. And I mean, I would be very hesitant at first, but I would also talk to my provider and see what's the best option for us and for my daughter. If we hadn't have taken a chance and joined the trials and then been on DAYBUE we've been consistently on it since 21, we wouldn't see the improvements that we see in Maddie every single day. And so my advice is to know that a lot of girls are having a tremendous results and very positive results, and the families are seeing things. And so if you feel like it's appropriate, have those good, hard, long conversations with your doctor about it, and express your concerns, because like Dr. Buchanan said, they probably have protocols and they have things that can help you manage things that you're concerned about. Or then you could be like Maddie, and maybe you don't have diarrhea, but maybe you spit up like she did. So though, you just never know what's going to happen and how your girls are going to respond to treatment.
That's helpful. That's great, Amy. Heidi, what about you? What's your advice to?
I fully agree with what she said. I think, it was so different in trial, where you're like in a bubble and you can't talk to anybody except your doctor. And, we did that for a long time. And I see these people now, like, in some of the chat groups and things out there, I see people talking about their experience with it and things they're doing. And everybody, has found or is learning how to cope with things. And there's also people I know that were in trial and had not a great experience, and they've restarted now and they are having a good experience. So they were able to go at it a different way. And there is so much more, tricks and tips on how to do this now. So, and I think the longer it goes on, the more we're all going to learn about it. And so I think as long as your doctor says yes, then you might as well try.
Yeah, I think that's great advice. I mean, We've learned a lot, I would say, certainly in the past 9 months since DAYBUE was approved back in March. And I think what I'm hearing from you, Amy, and from you, Heidi, is have an open mind. Obviously, do your homework. Speak to your doctor. Speak to maybe other Rett caregivers, other Rett families, and see where that journey takes you. But have a plan. Have a plan in place. And I think Dr. Buchanan, maybe round out this section of the discussion, and we can move on with your perspective.
Absolutely, and I just wanted to add, the side effects here are tolerability issues, and I have not yet seen a side effect that didn't resolve with discontinuation of the medication. And so, if you're hesitant, you're not specifically because of the tolerability or the side effects of diarrhea or vomiting or others that we've discussed tonight. You're not committing your child to those side effects for life. They do resolve if you discontinue the medication. So just as Heidi said, give it a try, because if it becomes to where your daughter cannot tolerate or your family can't tolerate it, you discontinue it and the side effects resolve. So I think that, to me as a provider, is just incredibly reassuring when prescribing a medication.
Yeah, so the side effects aren't permanent, right? And for those that experience them, not everyone's going to experience them the same way, but for those that do, they're not permanent.
Exactly.
That's good feedback. Well, I want to bring us back to a conversation with each of you about responses efficacy, because even in the Q&A, we're getting a number of questions around what's the impact been? Give us a little bit more detailed impact. What's the magnitude of the impact? What's the biggest thing you've seen in your experiences on DAYBUE? I want to go a little bit deeper on the changes that each of you have observed with your child. And I'll start first with Allison. Maybe just give us a little bit more color on what you've seen, what your husband and your family have seen, and maybe a little bit on, are other people seeing things as well? I think you mentioned maybe the grandparents had observed some changes at some point. So give us a little bit more detail on the specifics, the day-to-day benefit.
So like before we were on DAYBUE, we always used to say Claire's hands would like get in the way. She didn't do this really with her hands. She would grab one elbow with the other arm and then grab the leg with that hand. And so she kind of was like twisted up like a little pretzel. And it was very hard to get her to untwist. Like even if you held something in front of her that she really wanted, she had difficulty getting her hands to do that. And so she's very open and fluid. She does still clasp her hands in front of her. And she taps her fingers together and she'll tap her leg or the couch. But it's not like I could say, like, I'll hold something out and she'll grab it right away. Or I'll say, Claire, can you come here? And she'll stop what she's doing. She's more open and she has more control of her hands now. She's always been able to pick things up with her thumb and forefinger, but now we can see her point to things with her fingers. She'll touch her eye gaze device. She'll scroll like a champ on my phone through YouTube. If she's hungry, she goes over to the refrigerator. She taps on the refrigerator. She grabs the chips off the counter, to give to me. She will walk over and grab food off her plate. We're still working on self-feeding with a fork. She prefers her hands. I think it's just easier. But she can hold an ice cream cone. That was a big one. She loved that. In terms of her eye gaze, it's very improved. We're still struggling with learning her AAC device, which I think is more not learning it at all. She never saw an AAC till she was 5. And so just getting used to it. She's so mobile. She doesn't want to sit there in front of the AAC device. So we're still working on that. But she does use it in school a lot, and she'll use either her eyes or her hand to tap the buttons, answer questions. She knows colors, shapes, numbers, which to me is amazing. I didn't know she knew any of that until she was able to get it out and tell us. She has no words. She's completely nonverbal, but she has been more vocalized lately. She babbles a lot. She says syllables. She laughs so much. And like Heidi said, she laughs at appropriate moments now. Like something actually happens in the show and she's responding to it. It's not just that cute little Rett giggle. She's starting to have meaning behind her cries. Like I can tell that it's not just whining or crying for the sake of it. Like she needs something, and that's kind of helping. She used to have a lot of Rett episodes at night, especially in the middle of the night, where she would kind of have this hour-long tantrum that we couldn't get her out of. She does sleep a little better. She's not a good sleeper. That's one of our big Rett symptoms. She's a very, very bad sleeper, but since we've adjusted sleep medication and with the DAYBUE, she's sleeping longer. I'm getting from like 9 to 4, if I'm lucky, get a little 4 a.m. wake ups. But she's not waking up hysterical crying anymore. She's not waking up shaking. She's had less breath holding, less teeth grinding. Overall, you know, she's been on DAYBUE for 2 years, but as every parent knows, from 5 to 7 is a big 2 years. Like, a lot happens in your life. And some of the stuff that's happening is just neurotypical 5 to 7-year-old things. You know, we like to think that a lot of this is that plus DAYBUE helping her. And she's really just made really big strides in the last 2 years. And as a family, we've become more adept at knowing what she needs, and she's more adept at telling us what she needs in her own way.
That's super helpful. And just, let me just ask one more question to you. What's been the impact on you? What's been the impact on mom and dad? What's been the impact on your family? What have others observed? Give us a sense of, you know, how that has impacted, how DAYBUE's impacted your life as well.
Yeah, I mean, aside from the side effects that we mitigated, it's been really helpful because we've been able to do more as a family unit. A lot of times Claire was crying or she didn't want to be places. She didn't like being around other people. And so we had to tag team. Mom gets one kid, dad gets the other kid. And now we do a lot more as a family. We can go out to dinner and she will sit there calmly and she'll eat with us. And, you know, she might need her phone for a little bit, but it's not like where we used to have to go and get in the car and drive around because she was crying. We like to travel. We actually just went to Hawaii with her and survived a 9-hour plane ride. She was loving the beach. She was wonderful there. We love bike rides that we can do as a family, going out for walks.
That's great. Thanks for sharing that perspective, Allison. Amy, talk to us a little bit about your experiences with Maddie, especially again as an older participant in the trial.
Yeah, so Maddie suffered from breathing issues, like I've mentioned before. They were very severe. We call them blue spells just because that's the color her lips and her skin turns, and quite scary if you aren't expecting it. Maddie had a lot of them, and they were very severe, and sometimes upwards of 100 times a day of having those. And then since being on DAYBUE, they've dropped dramatically. She was having them so severely and frequently that her school actually instructed the paraprofessionals not to give her anything by mouth because it was just putting them in a risky situation. And so the breathing episodes were our worst side effect that Maddie was having, and those are so much better now. Like, I can't even put a number on what it is now. It's really, really improved. And so that's our biggest and our like, oh, just that alone. But Maddie's had a lot of other improvements. Nighttime behaviors was a huge issue for us. Maddie had night terrors. She had those hour-long laughing spells that are not funny, because you guys know what I'm talking about. They're not cool at 1 a.m. when they can't stop the laughing either. And it's just not funny for the entire family. We don't have those anymore. If she makes a noise now in the middle of the night, it's because she needs help repositioning or her feeding pump is going off. And so we go when we handle that, but we're all getting much deserved sleep and better sleep. And another improvement we've seen with Maddie is her eye gaze. And so it started with the alertness. And when you would speak with her, she would look at you. It's almost like Heidi said, it's like, oh, hey, yeah, there's mom. I see you. It's really kind of cool. So with Maddie, that happened. But Maddie also, since she is nonverbal, she started using her communication device like a champ. She did not like it prior to taking DAYBUE. She didn't use it. And when you did bring it out, she would cry. We continued with speech therapy, continued showing it to her, modeling it for her, showing how powerful it was, but she just never got it. And then after being on DAYBUE, she gets it. She has a huge vocabulary. She tells us lots of things. I was just trying to think of all the things. She's still nonverbal, like I said, but she vocalizes. She makes a lot of sounds. It's kind of cool. I'm hopeful maybe one day a word will come out. We'll see. she's in a good mood. She said she feels good, and that's really important to us. As far as hand movements, Maddie was an aggressive hand wringer, so much so she would leave sores on her hands most of the time. So we used to cut socks to make gloves and would put knit gloves on her, and we don't have to do that anymore. We've actually thrown all those away. So that's pretty cool. So now she does still wring her hands, but it's not aggressive. It's a lighter wringing motion. And sometimes even when she's awake and alert, usually the only time that her hands would stop wringing is when she's sleeping. But now we've noticed if she's calm, if she's listening to music or enjoying something and engaged in something, she may only just tap two fingers together or rest them in her lap. And so that's pretty exciting for us to see. I tell you, I feel like I could go on and on for days about the improvements that we've had with her. But I was also thinking about with mood, Maddie had a lot of anxiety and fear, and we couldn't go to big venues or events or places with loud noises. She had to have noise canceling headsets on all the time. Very rarely does she use those now. Honestly, she uses them now when she's riding on the bus, and she just doesn't want other people to hear the music that she wants to play. And so and like Allison said, we can go to restaurants now, and I don't immediately have to bring out the iPad to distract her, or one of us is not in the car with her, or one of us is not at home with her while the other parent is out with the family. So we're enjoying it.
That's great. Thanks so much, Amy. I want to bring you, Heidi, back in because you've had the experience now of over 3 years. So give us your kind of longer term perspective on trofinetide, and then maybe we'll ask one wrap up question for everybody. First with you, Heidi, just your longer term experience.
I just have to say it's mind blowing to hear Allison and Amy tell their experiences. I'm like kind of discombobulated with everything they've said. I'll keep mine short with Ellie, but I think the biggest thing we've seen with her is her overall mobility is better. Her hand movements are better. Her stimming is less. She has always been able to walk downstairs by herself, but recently she started almost doing it by herself upstairs. And more than the biggest thing is she has started saying words. Ellie never spoke. She never had words. An occasional pop out word, but she doesn't have that muscle memory in her mouth to get a word out. And she says fun and funny. She said love the other day. And at nighttime, for some reason, it's like it switches on and she starts trying to form words. And it went from, I would say, probably after we'd been on the drug about, I don't know, maybe a year and a half or 2 years, she started getting very, very chirpy. Like she would just be making all these noises. We're like, oh, this is great. And then that turned into, she started going, fa, fa, fa. And we're like, what? And then we realized it was fun, which turned into funny. And then now we're always working on words and trying to get her to form sounds, because the sounds, when she's talking now, you can tell her brain is saying, say this, and her mouth is trying, but it's still not that full connection to get it to form the word. But it's definitely sounds like words, so that's really exciting. But, for us too, like for the future, like I've said this before, this is our future. I mean, DAYBUE, we're going to be on DAYBUE as long as we possibly can be. I'm excited to keep seeing changes and keep seeing growth with her. We are seeing things continuously. So and we haven't had horrible side effects. So it's easy to stay on as well. And, it's changed our life as a family. Everything's calmer. Everything's more chill. We do things together. We go for walks, we go for bike rides, and it's just, she just keeps getting better. That's the only way I can put it. It hasn't stopped. It's never stopped. It's only continued to, her changes are growing continuously. And it's so exciting. And it's so, the other day she held my hand. She held my hand. I did not hold her hand. And now she started doing that. And school is saying, she's doing things like that. And the belly laughing that comes out of her, like she never had that before. And, she's her eye gaze, she actually, for the first time in, I don't know, 12 years, actually is using it. And she never had any interest in that before. So she'll pick TV shows, and sometimes she uses her eyes, and sometimes, thank God, it's so sensitive she can touch it, where the iPad she can point and touch, but you have to hit it just right. But the Toby, she can hit it, and she's able to select shows. So, I mean, it's just, I'm just excited to see, where are we going to be in a year, or where are we going to be in 2 years? Because it keeps happening. It keeps changing. So
Thank you.
That's
amazing. I mean, we can hear those stories all day, every day.
Yeah.
So I have one question. I think we heard from you, Heidi, on what's your why? Right? Why DAYBUE? Why try it? What's your longer term experience been? My final question for Amy and for Allison is, what's your why? And what's your final advice? What's your final advice for caregivers that are thinking about DAYBUE at this point? I'll start first with Amy. Why don't you kick us off?
Sure. My why is, why not? It's a medication, and if you do have the side effects, you can stop it. And like Dr. Buchanan said, they're reversible. So I just say, why not? Talk to your doctor, make a decision. We made a family decision. Maddie chose it to be on board with this, so we followed her lead, and it's just, to me, it's hope. Like I just want to say ditto to everything Heidi said, because where are we going to be in a few years? I mean, it's not stopping. It's just getting better. Yeah, we have bad days. Everybody does. We have Rett syndrome. I mean, they're going to be bad days, but we have many more good days than bad days now. And there's not been a plateau. We've just seen improvement. So why not give it a shot?
Thanks, Amy. And how about you, Allison?
I would say my why is Claire. Like, as her mom, I want to give her the best possible life. If she was neurotypical, I would be pushing her to do sports and, academics and whatever it is. Like, I want her to have the best life. And, one of the things that my husband and I kind of wrapped our head around early on was that she's not having the same life that her sister has, but it doesn't mean, it's just different. I want her to live every day of her life as happy as she possibly can be, because that makes me happy and that makes our family happy. And DAYBUE is helping her to do that, and I, like Heidi and Amy both said, if we had bad side effects, I might be saying, I might be hedging a little bit more. We're very fortunate that she's seeing improvement, and the side effects we had were manageable, and we are seeing it's slow. We are not moving very fast. We are moving slowly on this, half dose, but every little bit, every time she walks past me holding something, she's just feeding herself popcorn off the table. Like, that makes her happy, and I'm happy.
That's helpful. Well, let me thank you, Heidi, Amy, and Allison for joining us in this webinar and for sharing your experiences, your personal experiences, and what you've observed. I hope it's been impactful for those that have attended this webinar. I'm going to wrap us up here, and just a couple of closing remarks. I want to first thank Dr. Buchanan. Dr. Buchanan is at one of the 18 Rett Centers of Excellence across the country. I know there's been some questions in the chat about who they can speak with about DAYBUE, about Rett syndrome. Obviously, Dr. Buchanan and many of the COE sites across the country. She's in South Carolina. There's one in North Carolina, right? State above. They're scattered across the country. You can find more information about the Centers of Excellence on daybue.com. You can reach out to the IRSF to learn more about the Rett COEs. But thank you, Dr. Buchanan, for your perspective. Sean, thank you so much for what you do as a family access manager, you and your colleagues. As I mentioned, and as you heard from Sean, we got your back, and we will be there to support you if you decide that DAYBUE is the right treatment for you. If you have any questions about Acadia Connect, go to acadiaconnect.com, go to daybue.com. You'll see some more information and download some resources for yourselves as well. But last but certainly not least, I have to thank Heidi, Amy, and Allison again. Thank you so much for joining us in the webinar, for sharing your experiences. We very much appreciate it. We appreciate the personal context and stories that you're able to share. I think it helps bring the data to life, brings your experiences to life, and really answers a lot of the questions that we hear often from other Rett families that are considering DAYBUE. This is the first Discovering DAYBUE webinar of 2024. It's not the last. So we're looking forward to doing some more of these throughout the rest of this year. And You'll expect to hear more about some of the webinars that are coming up from us, and you can always go to our website to learn more about those that are coming in person, as well as virtual forums like this as well. So I want to thank all of you, our panelists, again, for joining us, all of the participants of the webinar this evening. We appreciate your time, and please do reach out if you have any further questions. And on behalf of Acadia, thank you so much and have a great night.
What are the possible side effects of DAYBUE? Diarrhea. Diarrhea is a common side effect of DAYBUE that can sometimes be severe. Diarrhea may cause you to lose too much water from your body, dehydration. Before starting treatment with DAYBUE, stop taking laxatives. Tell your healthcare provider if you have diarrhea while taking DAYBUE. Your healthcare provider may ask you to increase the amount you drink or take antidiarrheal medicine as needed. Vomiting. Vomiting is a common side effect of DAYBUE. Sometimes vomit can get into your lungs, aspiration, which could cause an infection, aspiration pneumonia. Tell your healthcare provider if you have severe vomiting or if vomiting happens often. Weight loss. DAYBUE can cause weight loss. Tell your healthcare provider if you notice you are losing weight at any time during treatment with DAYBUE. The most common side effects of DAYBUE were diarrhea and vomiting. Other side effects include fever, seizure, anxiety, decreased appetite, tiredness, and the common cold. These are not all the possible side effects of DAYBUE. Tell your healthcare provider if you have any side effects that bother you or do not go away. What should I tell my healthcare provider before taking DAYBUE? Before taking DAYBUE, tell your healthcare provider about all of your medical conditions, including if you have kidney problems, are pregnant or plan to become pregnant. It is not known if DAYBUE will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if DAYBUE passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby while taking DAYBUE. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking DAYBUE with certain medicines may affect how the other medicines work and can cause serious side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also call Acadia Pharmaceuticals Inc. at 1-844-4ACADIA, 1-844-422-2342. What is DAYBUE? DAYBUE is a prescription medicine used to treat Rett syndrome in adults and children 2 years of age and older. It is not known if DAYBUE is safe and effective in children under 2 years of age. DAYBUE is available as an oral solution, 200 milligrams per milliliter. The risk information provided here is not comprehensive. To learn more, talk with your healthcare provider and read the accompanying patient information. Visit daybue.com for the full prescribing information.